He is the former governor and now and always been doctor. Please welcome Chairman of the Democratic National Committee, Howard Dean, to Montel Across America. Thank you so much, Dr. Dean.
Like that applause, Montel. That sounds great to me.
I got hundreds of people here in the office there, so just stand by. So thank you so much for being a part of this conversation. Today, yesterday we were talking a little bit about healthcare and about food and about the fact that, and I'm a big proponent here on the fact that we can't really be having a healthcare discussion without talking about the fact that healthcare in America is really sick care. So if we're going to talk about
that's
healthcare,
a big problem. That's very, very, very accurate, and that's a huge problem. And this interesting thing, one of the things that's not being discussed in Washington is changing our healthcare model from an illness model to a wellness model.
Please, sir, thank you. I want more and more and more politicians need to be talking this way.
Yeah, no, they really do.
Because the impact, sir, could be incredible. I mean, I don't want to cut you off, but just like myself, I suffer from MS. And I've had MS, been diagnosed with MS for 10 years. I'm medicated. I take medication. I take three needles every day. I'm on about $1,500 worth of medications. God bless the fact that I have really good insurance to help me take care of this. But I also have only seen a doctor this last year once. Why? Because I exercise. I pay attention to my diet. I stay on top of my medication. I do all the things I need to do to prevent me going to the doctor and being a burden on the system. We need to start teaching more people how to do that.
That's right. And the problem with the current system is that nobody benefits from that. There's no reason to teach you how to do that, because if you do, then the hospitals make less money. The medication companies make less money. And if you had an integrated system, the kind of that President Obama wants to do with a public option so people could sign up to a really integrated system that's reasonably priced, then this might work. Right now, you go to talk to somebody about getting early intervention, they're not so interested. Why? Because they don't benefit from it. Well, they benefit by taking care of sick people, not preventing people from being sick.
When you hear people like John McCain say what he said yesterday, listen to this for a minute.
If we have a government option, then sooner or later it will dramatically increase the cost. It will crowd out private health insurance. And if you're doing it in the name of competition, we have 1,300 health insurance companies in America today. They're competing, but they're not getting the kinds of health care costs under control that's necessary.
I think right there, John McCain just basically said exactly what you said, sir.
That's right. It's interesting. Competition doesn't work in healthcare. It's a reverse effect. It's very unusual, but the more people you have providing, the higher the price goes. The more facilities you have, the higher the price goes, because more and more people use it. And they're encouraged to use it. There's a great article in the New Yorker by a guy named Atul Gawande, which shows that McAllen, Texas has got the highest healthcare expenditures of any place in the country, and their health isn't any better. They just got a lot of doctors that make money by running people through all these tests. And so it's just really, the insurance companies actually make matters much, much worse, which is why you need a public option to stop them from doing the kinds of things they do. And, with MS, you may have had some trouble with your insurance because a lot of insurance companies won't take people with pre-existing conditions.
Oh, without a doubt. Now, unfortunately, again, I happen to be part of SAG after, we're probably some of the best insurance in the nation, but I also find an abomination with this too, because in some ways, just because I have the insurance I had a shoulder rebuilt a couple of years back, and my shoulder cost about $37,000. If I had not been Montel Williams and had it done someplace else, it would have cost about $6,000.
Wow.
So so there's such a disparity in what some insurance companies can pay and some insurance companies won't pay. But let's go back to this public option.
Well, the other thing, just the reason why you go back to the public option, and speaking of insurance companies, insurance companies take a whole ton of the money off the top. They've got to pay their shareholders. They've got to pay their chief executive. They've got to pay for advertising. The public option doesn't pay for any of that. So that's why that's why the president wants it in there.
So the argument is, again, if we put a public option in, it will force, number one, some doctors will become part of, let's say, this kind of an association where they'll agree to pay lower costs, which will then drive the costs down, correct? That's really what the plan was.
Well, that's the whole point. The whole point is to stop what the insurance companies are doing. What the insurance companies, and evidently their pals in the Republican Party are doing is taking large amounts of money out of the healthcare system and putting it in their own pockets. That's why our system is so much more expensive than everybody else's, because it's all in the private insurance hands. There are a couple of countries where it's in private insurance hands other than the United States, but what they do is they treat the insurance industry like a regulated utility. Well, if that's what the insurance company in this country wants to do, that's fine with me, but I don't think they're going to want that. And right now, the Republicans and the insurance companies are just simply doing their best they can to keep the status quo, because all they care about is the money.
You are listening to Montel Across America, and we're so fortunate today to have former Governor Howard Dean, chairman of the Democratic National Committee, with us today talking about health care. I want to play something else for you, sir. And this one is really, you don't have to comment about the individual, but if you could comment about the sentiment, because the sentiment is what the far right is trying their best to shove down people's throats to make you believe that a public option will do to America. But this is what Rush Limbaugh had to say.
All this list of options that a dog owner has for its health, for its well-being, and they're all in the private sector, and there's no federal dog health care plan out there, and it's working just fine. And it's based on the dog owner's ability to pay. There's no insurance involved. Some of them don't even take credit cards, but it works. Are you comparing dogs to human beings? No, I'm comparing the private sector to the public sector. If the government was into dog care, if you had to take your dog to government-run Fur Seasons or whatever it is, I guarantee you wouldn't want to leave your dog there, because there'd be no guarantee it would be alive when you got back.
But it's this kind of ignorance in the debate, sir, that I think really clouds all of America's judgment. Number one,
yeah, he's just a whack job making stuff up. I mean, who's going to take Rush? Look, his popularity is at 20%.
But what's foolish is that most people think that he speaks for the entire GOP.
It's all right with me. Let him think that. I think some days I think he does, the way that Republicans are behaving in the Senate. This idea that the public option is always bad and government is the enemy is a foolish idea. It's harmful to the country, and it's cost us a ton of money. Our health insurance system here is 70% more expensive than the next industrialized countries. The other countries are eating our lunch, and it's because our politicians won't have the spine to stand up and alongside of the president say we need a public option. I mean, what's going on in the Senate now is kind of embarrassing, because what they're doing is they're fixing the Senate's problem, but they're not fixing America's problem. They're running around trying to get a compromise that 70 or 80 people will sign on to. Well, that's fine for the Senate. But the bipartisanship is wonderful, but it's not as wonderful as a really good health care plan. And my great fear is that the Senate will pass a lousy bill that won't do anything, except cost us $1 trillion, all because they all want to get along together. I think getting along together is fine, but we've gotten along together and haven't had a health insurance system for 60 or 70 years. Now it's time to do the right thing, even if we can do it with 55 votes, which we have the votes to do. And
we're going to run out of time real quick, so one last question. We're also looking right now at a time where America this year will probably graduate less than, I think it's 16.9% of its graduates will graduate with a degree that is commensurate enough to go to medical school, either in research or pre-med. That means over the next 10 years, we're going to see a shrink, additional losses in just available bodies to become doctors. How will we deal with that 5 years from now, 10 years from now, when the baby boomers reach ages where we're going to have to start seeing doctors more often, and there's not going to be enough doctors out there?
There's two ways to do it. Three ways to do it. One, you've got to help people who are going to medical school. The average person leaves medical school, I think, with about $100,000 in debt. And if somebody's willing to be a primary care physician, they ought to get a break on that debt. Secondly, you've got to encourage people by doing a better job with science education. And thirdly, and this is most important perhaps, some of the stuff that doctors do could be done by good nurse practitioners, and we ought to think about that too.
I can't say thank you enough, Governor, for being with us today. You guys been listening to Montel Across America. There was the chairman of the Democratic National Committee, Howard Dean, that's with us. Think he's got some answers and ways for us to at least start talking about the issue and putting in suggestions for real solutions. You're listening to Montel Across America. Montel Across America. We'll be back right after this.
Montel Across America.